Well, we all know that the pandemic has caused many issues in our daily lives, from job loss to feelings of isolation and quarantine.
But the virus has had different and even more challenging effects on many healthcare workers. You'll hear from those fighting on the front lines of COVID-19 while trying to protect their own families at home.
It's the hardest thing I've done in my nursing career so far.
The sentiment from nurses nationwide echoed here by healthcare workers fighting COVID-19 in Sioux City.
We're used to seeing death in the ICU. We're used to seeing hard cases. We are not used to seeing this at this amount and for this long. These people are ventilated for 4, 5, 6 weeks at a time, and then if they make it out, they got a long road ahead of them.
Melissa DeCook is a respiratory therapist at Unity Point Health St. Luke's. She has 7 children at home, and like so many working in healthcare, she's had to develop new ways of leaving her work at work, literally.
My main stress was, am I going to bring it back to them? So I'd be very careful about wearing my N95 all the time, face shield, gown, how I took it off. My shoes would never hit my car. I always had Crocs sitting in my driver's seat, so I would hang my feet out and put them in little totes, spray it with Lysol, and then put my shoes, my Crocs on, and that's what I'd wear into the house. And she's not alone. Dr. Mark Abraham, a general surgeon at Midlands Clinic, took extreme measures to protect his wife and children.
I did go through a period of self-exclusion from my family, so I spent a few weeks in my basement while my family had the run of the rest of my house. Had some meals delivered to the stairs every once in a while, and it was really out of the sense of being overly protective of my family, not knowing what could happen, not knowing how sick this could make my children or my wife.
It was kind of scary because it was like we couldn't really see our dad unless he had like a mask on and we talked through him through a window, or we were upstairs and he was downstairs.
So with the stress of an influx of critically ill patients at work and the struggle to keep their families safe, how do these healthcare workers cope?
I've started walking a lot more than what I did, and just, I guess, more focusing on my family. Like before, you kind of take things for granted. You know, your kids are there every day, you're doing the same thing. But now it's like, what if they're not there one day? Or what if I'm not there one day because of this? So I've taken more time and appreciate the little things in life, like gardening with my kids. I started a garden with them, so that's something that we've been kind of working on, or building a playground outside our house, stuff like that, you know, that I wouldn't have done because I thought I was too busy.
My only new coping mechanism is, like everybody else, I'm like, oh, this is a good time to do some home rebuilding projects. So I've done a lot of tearing things up, but not a lot of putting things back together. So that'll be the next step.
And sometimes there's just a need to decompress.
You're a nurse, you know the healthy things to do. Exercise, meditate, journal, vent, talk to a loved one, those kind of things. But you are so exhausted that in your personal time, you become a bit of a zombie, so you're just like a blob when you get home. Thank God for Netflix. I mean, that's what you do to deal. Everybody's got their own thing.
It's one thing for adults to understand the risk factors that come with working in close contact to COVID-19 positive patients, but try explaining the pandemic to kindergartners.
I have 5-year-old twins, which are the second youngest ones, and they are like, don't touch mommy, she's got Rona. So they know that if I'm wearing my red scrubs, not to touch me until I get in the shower, and then after I get out of the shower, they'll be like, are you Rona free now?
So as a general surgeon and trauma surgeon, I take quite a bit of call. My family understands that sometimes I'm just gone. This was a little bit weird because I would come home and go into the basement. My older two very much understood. My younger one did not understand, but she just came up with the phrase, "Daddy working," and she was okay with it.
Although the number of cases are starting to go down in some areas, doctors and nurses are still at a high risk of potentially spreading the disease after contact with coronavirus patients. And so they cannot do everyday activities with loved ones, like eating dinner or watching TV, things some might take for granted.
A lot of our feelings are just now happening after that surge. We're kind of going through some stuff right now. I feel like a lot of our families suffered because they didn't have the normal mom or dad or brother or sister there for them to support them.
Now, Freeze tells me she feels very fortunate to have been working in Sioux City during this crisis. That's where local restaurants and businesses, they've all stepped up to support these healthcare workers in the best way they could. She said even delivering hot meals to make sure these nurses and doctors had fresh food to eat after these long, taxing shifts at the hospital.
Yeah, Siouxland is such a good community. People come to the aid of others that they don't even know on a regular basis.
Haven't been here long, but I'm already catching on. It's a good community to live in.
Great story.
Thanks a lot.